At 2 in the morning, in a Soviet Antarctic station cut off by winter, a young surgeon prepared for emergency surgery. The patient had acute appendicitis. The nearest help was unreachable. The assistants had no medical training. And the surgeon and the patient were the same man. His name was Leonid Rogozov. He was 27 years old, a surgeon from Leningrad, and he had come to Antarctica with the 6th Soviet Antarctic expedition, not to become a legend, but to do ordinary medical work in a place where ordinary problems could become fatal. On the table beside him were surgical instruments. Around him stood 3 frightened men in white coats. Rogozov was frightened too, but the appendix did not care, the weather did not care, and Antarctica was not going to send help. So he picked up the needle, injected himself with local anesthetic, and began. Rogozov had sailed from Leningrad on the diesel-electric ship Ob in November 1960, part of a Soviet expedition sent to build a new polar station in the Shirmacher Oasis. After weeks of work, Novolazarevskaya Station opened on February 18, 1961. They had finished just in time. The sea froze, the ship left. Polar winter came down around them with darkness, storms, and the kind of cold that turns distance into a wall. Only 12 men remained at the station, and for the long winter, they would have only themselves. Rogozov was the doctor, but polar expeditions are not famous for generous staffing, so he also worked as a meteorologist and drove the terrain vehicle. At the end of the world, job descriptions were decorative. For several weeks, life became routine. Weather observations, repairs, equipment checks, meals, and the disciplined boredom of men trapped in a frozen outpost. Then, on April 29th, Rogozov felt unwell. Weakness, nausea, fever. Then pain began in his abdomen and moved to the lower right side. For a surgeon, it meant recognition. Rogozov diagnosed himself with acute appendicitis. He tried to keep it quiet at first. In his diary, he wrote that he was even smiling because why frighten his friends? Who could help him anyway? Appendicitis can start as a small local problem, but if the appendix ruptures, infection can spread through the abdomen and turn into peritonitis, sepsis, and a very fast demise. The man tried everything short of surgery: rest, hunger, local cooling, antibiotics. It all failed. By April 30th, Rogozov was worse. His temperature rose. Vomiting became more frequent. The pain stayed. Evacuation was discussed, but there was no aircraft available, and the weather made flying impossible anyways. There was no rescue coming. The station had one doctor, and now that doctor needed an operation. By the evening of April 30th, Rogozov accepted the only possible plan. He would operate on himself. His room was stripped down and turned into an improvised surgery room. The bedding and instruments were sterilized. The assistants were chosen from whoever could keep their hands steady: a meteorologist, a mechanic, and the station director. This is not how medical schools recommend staffing an operating room, but the alternative was waiting for the appendix to burst. Rogozov explained the procedure to the team. He prepared syringes in case he lost consciousness. He instructed the assistants how to inject him and how to provide artificial ventilation if things went badly. He positioned himself semi-reclined, half turned onto his left side, with his right hip raised. He chose to work without gloves because he expected to rely on touch. At 2 a.m., the operation began. He injected the abdominal wall with Novocaine. 15 minutes later, he made the incision. The mirror helped, but it also betrayed him because it reversed the image. The depth of the wound was hard to see. Most of the time he worked by feel. For the first half hour he continued steadily. Then his body began to fail. Weakness came hard. Vertigo followed. Every few minutes he had to stop, breathe, gather himself, and force his hands back to work. The assistants stood close, pale and dizzy themselves, passing instruments and holding the light, while their only doctor cut into himself. His strength kept fading. His hands felt weak. His heart seemed to slow. Then he found the appendix. It was severely diseased. One more day, and it would have burst. At the worst moment, he thought it would end badly. Then he realized the strange truth. The most dangerous part was almost over. He removed the appendix, placed antibiotics in the abdominal cavity, and closed the wound. The operation lasted 1 hour and 45 minutes. When it was done, Rogozov told the others how to clean and put away the instruments. Only then did he take sleeping tablets and rest. The next day, Rogozov's condition was still poor, but he felt better. He continued antibiotics. After 4 days, signs of infection disappeared. After 5 days, his temperature returned to normal. After a week, the stitches were removed. Within 2 weeks, he was back to normal duties. Because Antarctica does not care that you recently performed abdominal surgery on yourself, there is still work to do. More than a year later, the Novolazarevskaya team left Antarctica. Rogozov returned to Leningrad, resumed his medical career, and eventually became head of a surgery department. The self-operation made him famous. He received honors. The photographs became legendary. But Rogozov himself rejected the mythology. Years later, when people tried to turn the operation into something grand, he answered with a smile, "A job like any other, a life like any other." That is almost absurdly modest, but it also explains the story better than any monument. Rogozov did not survive because he was reckless. He survived because he was trained, disciplined, and clear-eyed enough to accept reality even when reality became ugly. He diagnosed the problem. He made a plan. He turned amateurs into assistants. Then he picked up the scalpel and did the job. Because there was nobody else.